You might have heard of the novel coronavirus, more officially known as COVID-19, standing for coronavirus disease, and 19 because it was found in Wuhan, China in 2019. COVID-19 isn't the first coronavirus to exist. Other strands have been tied to the common cold, and others are traced back to animals, like is the case with MERS and SARS. What sets COVID-19 apart is there's no past evidence of its existence, so not much is known about it. What is known is that people get the disease from each other. Just being within a 6-foot radius of someone who has COVID-19, and you can possibly get it, or through contact with surfaces that have been exposed to it. When a person with COVID-19 coughs or sneezes, they release contaminated droplets that travel in the air and can infiltrate the mouth, nose, or eyes. Through these droplets, the virus reaches the mucous membrane at the back of the throat. There, the virus's proteins connect to a receptor on the cell membrane, sending its own genetic code and duplicating itself, as well as converting other cells. At this point, a person with COVID-19 would have a sore throat and a dry cough. The disease then moves through the bronchial tubes until it enters the lungs. When this happens, the mucous membrane in the alveoli swells and puts stress on oxygen circulation and filtration of carbon dioxide out of the blood. Because of this, pneumonia can develop from fluid, pus, and dead cells filling the lungs. If the virus progresses, in order to breathe, one might need the assistance of a ventilator. If it progresses even further, it can develop into acute respiratory disease syndrome, where fluid occupies so much of the lungs, breathing aids are rendered useless, and that person dies. Although that is the worst case scenario, 80% of people who contract the disease experience rather moderate symptoms. 20% develop more serious symptoms. It all comes down to the strength of one's immune system. Those who are at higher risk of having the more threatening symptoms are the elderly. Also, those who've had a history of illness. 2 to 14 days is how long it can take before any evidence of infection can be seen. Symptoms to look out for are a sore throat, fever, shortness of breath, and coughing. A healthcare provider should be contacted if experiencing these symptoms. A hospital should be contacted for more serious symptoms. To help protect oneself and others, frequently wash hands using soap and water, and do this for 20 seconds. Commonly used surfaces should be sterilized, like sinks, phones, doorknobs, countertops, and other surfaces like these. To reduce the spread of COVID-19, avoid intermingling with others, and stay at home. Be safe and stay healthy.